Hello and welcome back to my channel. Today we're going to talk about a very common but often confusing issue, abnormal uterine bleeding, or AUB for short. If you've ever experienced heavy, prolonged, or irregular periods, you're not alone. This condition affects millions of people with a uterus, and understanding the causes and management options is essential for maintaining your reproductive health and overall health. Hi, I'm Dr. Knapp, family medicine physician, here to bring you medical information so you can take control of your health and make the most of your doctor visits. Let's get started. Let's start with the basics. What exactly is abnormal uterine bleeding? AUB is a term used to describe any bleeding from the uterus that differs from your typical menstrual cycle. This might mean periods that are heavier or longer than usual, spotting between periods, bleeding after intercourse, or even bleeding after menopause, which is always a cause for concern. The menstrual cycle, when functioning normally, is a complex interplay of hormones, mainly estrogen and progesterone, that prepare the uterus for potential pregnancy. When this system gets disrupted, bleeding patterns can change, sometimes dramatically. To fully understand abnormal uterine bleeding, it's helpful to break it down into two broad categories: structural and non-structural causes. Let's explore both. First, we'll discuss the structural causes of AUB. The easiest way to remember these is with the acronym POM, which stands for polyps, adenomyosis, leiomyomas, and malignancy, or hyperplasia. Uterine polyps are small, benign growths of the endometrial tissue that can cause unpredictable spotting or heavy menstrual bleeding. They often occur around perimenopause but can develop at any age. The good news is that polyps are usually treatable with minor procedures like hysteroscopy, where the doctor can both diagnose and remove the polyps. Next is adenomyosis, a condition where endometrial tissue grows into the muscular wall of the uterus. This can cause heavy, painful periods as well as a feeling of fullness or pressure in the lower abdomen. Adenomyosis can be tricky to diagnose, often requiring imaging such as an MRI, but treatment options include hormonal therapies and, in more severe cases, hysterectomy. Leiomyomas, more commonly known as fibroids, are non-cancerous tumors of the uterine muscle. Fibroids are incredibly common and can cause heavy menstrual bleeding, pelvic pain, and pressure symptoms like frequent urination. Depending on their size and location, fibroids may be managed with medications, minimally invasive procedures like uterine artery embolization, or surgical options such as myomectomy. The M in POM stands for malignancy and hyperplasia. Any postmenopausal bleeding should be investigated promptly to rule out endometrial cancer, or a precancerous condition called endometrial hyperplasia. Early diagnosis here is key to successful treatment. Now that we've covered structural causes, let's move on to non-structural causes of abnormal uterine bleeding, which are summarized by the acronym COIN. That's C-O-E-I-N. The C stands for coagulopathy, which refers to blood disorders that affect clotting, such as von Willebrand disease. Surprisingly, up to 20% of people with heavy menstrual bleeding have an underlying bleeding disorder, and this is something that can be tested with a simple blood panel. The O represents ovulatory dysfunction, a very common cause of abnormal bleeding. This occurs when the ovaries don't release an egg regularly, leading to hormone imbalances. This can result in long cycles, skipped periods, or unpredictable heavy bleeding. Ovulatory dysfunction is common in conditions like polycystic ovary syndrome, or PCOS, as well as during adolescence and perimenopause. The E is for endometrial disorders, essentially issues with how the uterine lining builds up and sheds each month. This can lead to irregular, often heavy bleeding without any obvious structural abnormality. I stands for iatrogenic causes, which simply means that medical treatments themselves can cause abnormal bleeding. This includes things like hormonal birth control, copper IUDs, and certain medications such as blood thinners. Finally, the N is for not yet classified, meaning there are still some cases of abnormal uterine bleeding that don't fit neatly into any of these categories, and ongoing research is helping to better understand them. Now that we've explored the causes of abnormal uterine bleeding, let's talk about how it's diagnosed and, more importantly, how it can be managed. The diagnostic process often starts with a detailed medical history. Your healthcare provider will want to know about your menstrual patterns, how often you bleed, how long it lasts, and how heavy it is. They might also ask about symptoms like pelvic pain, bleeding after sex, or any family history of bleeding disorders. A physical exam, including a pelvic exam, is usually the next step, and from there, additional testing may be needed. This might include a transvaginal ultrasound to assess the structure of the uterus and ovaries, blood tests to check hormone levels and screen for anemia or clotting disorders, and in some cases an endometrial biopsy to rule out cancer or hyperplasia. When it comes to managing abnormal uterine bleeding, there's no one-size-fits-all solution. The best approach depends on the underlying cause, the severity of symptoms, and a person's reproductive goals. For many people, medical management is the first line of treatment. Hormonal therapies such as birth control pills, patches, or hormonal IUDs can help regulate the menstrual cycle and reduce heavy bleeding. Progesterone-only therapies like oral tablets or injections can also be highly effective, especially for people with ovulatory dysfunction. Non-hormonal options include medications like tranexamic acid, which helps the blood to clot and can significantly reduce menstrual blood loss, and non-steroidal anti-inflammatory drugs, or NSAIDs, which can both reduce bleeding and alleviate menstrual cramps. I just want to take a moment to ask that you hit that like button and subscribe to my channel. Leave a comment below if you have any topics you want covered in future videos. Anyway, for those who don't respond to medical therapy or who prefer a more definitive solution, surgical options are available. Endometrial ablation is a minimally invasive procedure that destroys the lining of the uterus, often leading to lighter periods or no periods at all. This is a great option for people who are finished with childbearing. For larger structural problems, procedures like myomectomy to remove fibroids or even hysterectomy, which is the removal of the uterus, may be recommended. While a hysterectomy is a major surgery with a longer recovery time, it provides a permanent solution for abnormal uterine bleeding and is sometimes the best choice for severe cases. One of the most important takeaways is that abnormal uterine bleeding is not something you have to just put up with. If your bleeding is affecting your quality of life, causing anemia, or creating emotional distress, it's absolutely worth having a conversation with your healthcare provider. There are so many effective options available, and finding the right one can make a huge difference. Thank you for watching. As always, take care of yourself and make the most of your day.